Hello and welcome to the Plaster podcast. In this episode, I will talk with Will Ratliff, an old high school friend who turned to the medical field at an early age. He is now the head nurse and lifestyle coach at Transcend Ketamine Clinic in Austin, Texas. In this episode, we discuss the ketamine experience and its uses in treating depression and traumas. We get into Will's story, PTSD, rites of passage for young adults, and changing lives. If you like the contents of this episode, share it with your friends. Please also consider supporting this channel, which will help provide high-quality content to you at subscribestar.com/plaster. Now enjoy Will Ratliff at the Transcend Multimodality Ketamine Clinic.
No, this is really cool.
What tea are you drinking?
Green tea. There's no caffeine here. This is so
Isn't there
great.
caffeine in green tea?
I have to play with these things. These are amazing. In general, mental health is the one area that I never really worked in. In the emergency room, of course, we treat acutely suicidal patients, which is generally a shit show. Patients come in, they say, I'm suicidal. They clearly need help. We just take all their possessions away. We put them in a purple gown. We start an IV on them. We draw labs. We check for all of these levels, and then inevitably transfer them off to hospital, where about 24 hours later, they see a psychologist, and they put them on meds that take about, a month to have any effectiveness on. Usually they're released from the hospital within 2 to 3 weeks with a contract saying that they won't kill themselves, which after 2 to 3 weeks of being in a psych facility, almost anybody will sign that contract to get the hell out of there. So it's a really bizarre model that we currently have, and I've watched this over and over again in my nursing career and throughout EMS, and just always felt like that was a particular patient population that I never really made a good impact on. I never really felt like I was benefiting in any kind of way. I just felt like we were, going through the motions. And then through working EMS from a young age, starting out 21 on the ambulance, I dealt with Ptsd symptoms, pretty early on. I didn't know what those were. I kind of thought that, generally speaking, maybe I wasn't really cut out to do EMS. I didn't realize that most providers were experiencing exactly what I was, especially those that had started really young. And I've dealt with depression since I can remember. I remember, not being a happy person in third grade. And I've spent most of my life working on my depression and my PTSD with therapy and lifestyle things, such as exercise, working on my diet, meditation, and really have avoided, any form of pharmaceutical medication for any of my symptoms, and had really good success with it. And so it's just something that I personally am really passionate about, helping those with PTSD, helping people that have chronic depression that doesn't seem to be getting any better, and avoiding pharmaceuticals if possible. Part of my own recovery from these things was through, use of psychedelic medications and substances that there was no legal alternative for. And so when I first heard of, ketamine and its use, I used ketamine for years on the ambulance. It's a real common medication to be used in EMS for, the facilitation of intubation, for, people who are trapped in a car and you've got to extricate them out, but they're in too much pain. You have to knock them unconscious to get them out of the car. We give them ketamine, and then, we'd been using it for years. And first time I ever heard about this, I was working in a rural ER, and this physician said that he had this patient that inevitably was, really having a lot of suicidal ideation. And she came in, she was actually combative because she didn't want to be in the hospital, they were going to restrain her essentially. So they decided to they give her some ketamine, and they decided to restrain her and put her on a ketamine drip. And apparently the nurse inevitably failed to change the bag because it was a busy ER shift for her. And the patient essentially, when he went to go check on him, was laying unconscious in bed and said, hey, I actually feel completely better and would just kind of like to go home now. And he's like, well, he thought it was just a bizarre phenomenon, and of course, inevitably still went through the normal chain with that patient. But it led him to do a whole lot of research on ketamine's use for depression, because at the time in Canada, they were using it a lot. There was some studies. And that was the first I had ever even heard about it. I was like, wow, that's bizarre. But I knew it was probably the psychedelic aspect of ketamine that was doing it. And so that was the first time I ever really kind of heard of it. And immediately as he said it to me, I was like, someday there needs to be a place that does this. There needs to be a place that just utilizes ketamine all day, for patients that have these problems. At the time, nothing like that existed that I knew of, not any large clinics anyway. There probably was many psychologists at the time that were doing it. It just wasn't really popularized by any means. And so, some years go by, more EMS work, more work in the hospital, etc. And, just more kind of passion building towards mental health conditions. I found myself working in drug rehabs, which is bizarre because, most of the patients that I worked with were dual diagnosis. They have depression, anxiety, PTSD, and drug and alcohol addictions. Drug and alcohol addictions were usually secondary. They were just using, drug and alcohol as self-medication. So, working in these settings, I realized this system is further broken. We put people on Valium for a period of time and slowly wean them off, which is, kind of a bizarre way to handle drug and alcohol addictions. Just leave someone in a room, sort of in isolation for a long period of time, medicate their symptoms, and kind of inevitably discharge them. And of course, the relapse rate is really high. But became more and more passionate about, the use of ketamine over the years. And, I inevitably end up researching it again. And at this point, there's clinics doing this. There's just handfuls of them, And so, I continue to just keep my eye on this whole thing. I thought maybe I'll go work at one of those places someday, And, at some point in time, I actually did. I went and looked into working at one of these clinics and realized immediately that no place that I found actually does it correctly. Because you can give ketamine to people and they will have a neurochemical response. Most patients, if you give them 6 ketamine infusions over a period of 2 to 3 weeks, you will see a significant reduction in depression symptoms. By the numbers, 6 infusions over a 3 weeks period of time, at 0.5 milligram per kilogram will have, a 60 to 80% reduction in symptoms of depression. It's, pretty consistent throughout the literature. But when I went into these places, I just saw people getting infusions, and I was thinking, this is an extremely missed opportunity to have therapy going on intra-session and afterwards, and integration sessions afterwards. And then furthermore, a huge problem with medicine as a whole is just a complete, no focus on lifestyle modifications whatsoever. You have patients, they go to their doctor says, hey, you have high cholesterol, the doctor puts them on a cholesterol medication, and then they're kind of like, cool, problem fixed. That problem's not fixed. That should be used as just a transitionary period of time. Okay, we're going to put you on this pill for a period of time. It's going to keep your cholesterol down transiently. You've got to start exercising, getting your diet in order, because we're only going to keep you on this medication for 6 months. After that, we don't prescribe it anymore. That's the way it should be done. In the same way with any form of antidepressant, there are plenty of patients that, probably do need some form of pharmaceutical management. They have extremely severe symptoms, actively suicidal. Those patients probably do need to have a pharmaceutical medication to manage their symptoms. Otherwise, their mortality increases. But that's not the solution. You don't just supplement neurotransmitters to solve a problem. You try to figure out why they were off in the first place. Mm-hmm. And so, diet, exercise, meditation, these things, in and of themselves, you might find a study that says, there's a 62% reduction in exercise if you will work out 3 times a week for 45 minutes at a max heart rate of 80. Okay, that's a huge reduction, much more than pharmaceuticals can. And then you need to read another study about the reduction in symptoms that you can get from meditation, and the reduction in symptoms when you get your diet in order, and all, you know, the improvement in sleep. All of these different areas. You tack enough of those together, and you get a really significant proportion of the symptoms taken care of. You know, so the idea is, you know, you can start on a pharmaceutical medication, get all these things taken care of, and then get off pharmaceutical medication. Yeah, exactly. I wanted to create a place that I wish had existed when I was dealing with things.
Yeah.
You know, I wanted to create a place where someone could go and the situation be comprehensively taken care of. With our experience and background here at Transcend, we're particularly good at working with veterans and first responders because that's who we are. Paul Dannon, our clinical psychologist, he's worked extensively with veterans, particularly in the realms of PTSD and, you know, forms of trauma, depression throughout his career. Cord Cunningham has as well. Me, I just personally understand working with first responders and what they particularly deal with. PTSD, to just lump it all into one category and say you have PTSD, that's really different. The PTSD that a woman that was raped would experience, someone who dealt with, you know, being molested as a child, someone who went through military service, somebody who went through military service but didn't see combat, but just dealt with stressful periods of time. They're all completely different and should be treated differently. You know, we're really trying hard to focus on, you know, these two patient populations because they're completely ignored. You know, there's no great solution for veterans right now in relation to treatment of PTSD. It's mostly pharmaceutical management only and therapy, which therapy is fantastic in and of itself, but a lot of times the problem is you know, depending on the study, you know, 16 to 22 veterans a day commit suicide. So, you know, a lot of times we don't have time. We don't have 2 to 3 years, you know, of therapy to inevitably make, you know, a significant reduction in symptoms to the point where somebody inevitably kills himself. So there's really good reason to accelerate the therapeutic process with something like ketamine. I would say that the access to very specific mental health treatment for first responders in general is not there. Most of what I experienced in my EMS career was when you had a rough call, you know, and you say you needed time off after that rough call. A lot of times that is not an option. Some services have critical incident stress management. I never worked for one that did. You know, even when I flew on the helicopter, they just would refer you to a normal therapist, and when you'd go to a normal therapist, you'd spend most of the time just trying to explain what you even did for a living, and they'd kind of be enamored by it. They never really got to the thick of helping you out with coping with what you're dealing with on a regular basis, and especially with the fact that you're still working in EMS. So it's not like it's over. You will, in 2 weeks from now, experience another trauma, and then 2 weeks from now, experience another one. And you're gonna consistently be compiling more and more traumas throughout time. And so the difference between somebody like that, you know, so if someone has a traumatic experience and wants to work on that, that's something that is really easy to do therapeutically. But somebody who's consistently dealing with traumatic experiences over time, building that resiliency while still trying to cope with ones from the past is something that is different, you know. So every patient that comes in, I go over lifestyle modifications. I try to find things that I can identify, factors that are related to their symptoms. You know, almost every patient that comes in and has issues with sleep, you know, so we try to work with getting that, you know, improved. Almost every patient that comes in could do slightly better on their diet or start exercising better, different, or more. Some patients have that together, so it's very independent. Some of our patients, they're working out too much, and that needs to be, you know, brought into balance. Some patients are too hyper-focused on their diet, and they need to let go a little, you know. But we go over meditation, with patients, and we try to tailor the types of meditation that we go over to the patients. Some patients will do better with a concentration-based practice. Some patients will do better with more of a mindfulness. Based on their symptoms and what they're going through, I can kind of figure out what types of meditation practices will be beneficial. Some people will need a more movement-based meditation, something like yoga. And it needs to be completely different, but we go through all kinds of things. So I look for recent antibiotic use, we look to correct biome, we go over any possibility of deficiencies, we run labs on patients, and if those labs come back abnormal, then we correct them, or we make suggestions of how they could correct them through diet. We try to look at every single possible factor that could be contributing to this person's symptoms and fix every single variable, because if you leave anything out, they will inevitably relapse. And I like to think that the physiology always kind of wins. So the deal is, therapeutically, we might really handle somebody. So if you look at depression as a whole, in particular, then what you're going to see is that there's the psychological aspect, there's a spiritual malady, and there's physiological symptoms. So, the physiological symptoms a lot of times will inevitably cause someone's psychology to go awry. Someone's psychology will impact their ability to handle their physiology. So, in other words, these things are a cycle. So, if you work out on a given day, you may have less anxiety later that day. That less anxiety might help you to sleep better. That good night's sleep might help you have less anxiety the next day. So the interplay between psychology and physiology is very extreme. So I meditate twice a day, every day. I get plenty of exercise. I'm definitely one of those people that if a few days goes by and I haven't exercised, my stress levels build, my anxiety builds, and I start dipping back into a state of depression. My symptoms will never go away. They are right there waiting for me as soon as I slip up. And it's extremely important for me personally to keep them at bay, and I know how to, but it's been a lifetime for me to tailor my approach to figure out exactly what I need, and I've learned a ton from doing that, and I can talk to somebody for a few minutes and figure out exactly where the holes are. You don't have to be perfect. I don't do everything perfectly. I miss meditation exercises all the time. There are, many days that go by where I do slip up on exercise. Things happen. Every now and then you get an infection, you have to take an antibiotic, and you have to get your biome back in balance. These things happen. You don't have to be perfect. But if you're nailing it 80-90% of the time, when you slip up that 10-20, you'll be fine. And so I don't try to take an extreme approach with any of my patients either. I just try to baby step it. Usually we just work on one or two things at a time. So if somebody is just, every single factor is off, then I'm not going to go, you need to correct these 20 things if you want to feel better. I'm going to pick the biggest thing, the keystone thing that was going to make the biggest difference for them in time, and work on that first. One of the biggest things for me, I noticed the biggest drop in my symptoms when I started doing jiu-jitsu, because jiu-jitsu was like a keystone thing for me. So it came with a community of people, so social interaction and engagement. It came with a lot of exercise, but it also, when I was exercising at that level, I was more motivated to keep my diet in order, So these things sort of radiate out, and I try to always find these keystone things for people. So a lot of times, I won't just tell a patient like go running 3 times a week for 45 minutes, because they'll do that for a period of time and they will probably have benefit from it, but it won't be, there won't be any longevity in it. More likely am I, going to say, why don't you do a social sport with some friends, or it seems that you really like nature. So maybe like running out in nature with a group of people, might be something. So I'm always trying to find something where I can tack down 3 to 4 categories with one change in someone's life. Trying to find those keystone habits to change. Well, I think a lot of times that, my patients, they hear things from me and they won't think that really makes a difference. So in other words, I might have a patient and I say, okay, well today after your session, go outside, walk barefoot in the soil, get some sun shining on your skin. and they're kind of like, how the hell could that potentially make a difference? But then they do it and it does, so a lot of these factors are well studied, being in nature, connection in general, but connection to nature, is studied to improve people's symptoms, particularly from depression, anxiety. But, things like grounding, getting appropriate sun at appropriate times of day can help out with circadian rhythm balance. And so I try to find one activity that somebody can do to, approach multiple categories that could potentially impact them.
Okay.
My goal is always complete remission of condition, or complete remission of symptoms. So there's no reason why, anything that anybody comes in here with isn't potentially curable. There are some disease processes that, can only be symptom managed. But I think that somebody that comes in with treatment-resistant depression, or severe anxiety, PTSD, a past trauma, maybe OCD, or even chronic pain, there should be no reason why we can't inevitably find remission for this person. And maybe they still deal with 10%, 20% symptoms, but when you're dealing with somebody who's, chronically suicidal, chronically depressed, and has been for some time, 10-20% symptoms is basically remission. It's not unattainable, and I think that's the problem. Is many clinicians are completely happy with just reducing somebody's symptoms 30% to the point where they're livable. That they're making it through their day. And I just had a patient a little while ago. She's had a 75% reduction in her symptoms. The way I see it is we've almost smashed it. There's 25% left to go. Plenty of people would say we're done. We've caused a significant reduction in this person's symptoms. Now I think, what are the last few things that we can nail down that actually get this person with no symptoms at all?
So I don't know if you know this about me, but I've experienced lifelong depression, chronic. It was when I moved to LA that I was like, it was really bad. Nothing was changing when I left my environment of home in Austin. I was always trying different therapies, right? I was trying all sorts of shit, and I've always been obsessed with getting better, whatever that meant, becoming better. It wasn't until the first really big change I experienced, and it actually changed everything, psychology and personality and everything, was when I listened to Joe Rogan, and he had an endocrinologist named Mark Gordon on. And he talked about testosterone replacement therapy for traumatic brain injury. And then I immediately called up his office, and it turns out that he was not far away from me in LA, although he works with patients remotely as well. Put me on a testosterone protocol along with other hormone therapy, basically just vitamins, and Clomid. Clomid was the only, clomiphene was the only prescription. And within a few months, I noticed a huge change, everything changed. I'm like, what the fuck? This is crazy. And then 6 months went by, and I was like, I haven't gotten depressed again. Because every 6 months I would go into this deep, dark, abyssal depression, right? And
what time of year?
Just anytime.
Yeah, it was random.
It was just every 3 months to 6 months, I just fucking crash, right? Hard. I can go into that. It was anyway, it was bad.
Yeah.
Depression's bad. But then 6 months passed and it didn't happen. 9 months, a year. I was like, oh shit, this is I was scared. I was
scared for the next one.
I might fall really bad, but it just never happened. And then I felt better when I did feel a dip, but it wasn't so crazy. It was a regular dip in a human experience. It was
yeah.
High, low, high, low.
Were you having highs? It
wasn't manic depression, Was I?
Did you ever have highs though?
Oh yeah. Oh, you mean during depression, during that time of depression?
So no. I mean, so in other words, was there ever a period of time where you were dealing with not only do I feel better, I feel fucking amazing.
Relatively speaking, because I wasn't underneath that line. Everything above that line was amazing, but relatively, even if it was just me enjoying a regular day, to me, good is great, you know? So, and it's the same with like not experiencing trauma. Like my whole childhood was trauma. So if I'm an adult and I'm making choices for myself and I'm creating a good environment, then that's amazing compared to.
Do you have a therapist?
No. Well, not currently. I don't have a therapist.
A little hard when you're on the road and stuff and you're kind of moving around and grooving.
Yeah. Well, most of my therapy is like having conversations with friends. I'm looking at role models.
And that's undervalued. Yeah.
You know, I creating my own therapy, although a psychotherapist would be amazing to talk to about myself.
Well, I think addressing childhood trauma is extreme. I mean, I didn't realize that I had any, you know, I thought I had a pretty regular childhood, you know what I mean? And then in actually kind of reviewing it, I'm like, oh, I could see how that would actually be kind of traumatic, you know? There was, you know, definitely facets that even a fairly normal upbringing, you know, because a lot of times, and this is what's actually really confusing for people, and you know, I could talk about this for a minute too, but there's always some worse case. Like they weren't chained up in the basement getting just whipped and starved. Like, and so they think that there's just no right to like have any symptoms from anything, you know? Well, there's always a more extreme example. And I see this a lot of times with veterans with PTSD. They're like, I didn't even really see combat, but for some reason I have these symptoms, you know?
How does that work?
Stress over time. So, you know, you can have one acutely stressful event that causes amygdala hypertrophy, or you can have stress over time.
Would you say that again slower, that word?
Yeah, so your amygdala, the fear center of your brain, this is more complex than this, but this is the you know, as with all things neurochemistry, brain, whatever, it's always way more complex than, you can't really sum it up in a sentence. But generally speaking, the amygdala gets too big. So hypertrophy just means growing. You know, like when your muscle gets bigger, it hypertrophies, right? So when you do brain scans on people who've, you know, been through traumatic experiences, especially a lot of traumatic experiences over time, they inevitably usually have an enlarged amygdala and an atrophied cerebral cortex. And basically what that means is your brain is now primed to do very specific things. Don't think about things too deeply. Don't think about abstract thoughts too much. Don't be daydreaming all day, because we need to be on alert, you know? And so you become, you know, hyper attenuated, hyper vigilant, any way you want to term it. You get ready for action at any moment. You get that on-off switch is just ready to go on, you know, and stay on, and it can't come off very easily at all. And, you know, I mean, that's what I dealt with quite a bit was, and a lot of times it's kind of obscure things. It's not even always the thing that you experience. It's sometimes just being in an environment where you might experience something like that. So in other words, it's not that you got blown up in a roadside bomb, but you have 5 friends that did, and you're regularly doing the same thing that they did. And so you're like, you know, you're ready to go. You do that to yourself over a period of time, you expose yourself to those situations for long enough, and inevitably you're gonna have like actual cerebral changes that there is, the way you see it is, you know, then these symptoms of PTSD and things like this.
If your environment has the expectation,
sometimes that's a factor that's like overlooked. So like, you know, as an example, like, so kids that grew up, you know, in a high stress environment, maybe, you know, a parent was abusive. Well, maybe they weren't abusive that much, but generally speaking, they were on edge all the time. They're on eggshells all the time. Sometimes that has as much of an impact, or even the way that it felt to the child. So in other words, you know, and this isn't totally my specialty, I'm not a therapist or anything, but this is just my understanding of it. It's just the way that it felt to the child sometimes is as much of an impact as the actual events that happened. So maybe a child felt unloved. Maybe the parents were working really, really hard to make them feel loved, but there was just a few factors that happened at certain times that made the child generally feel unloved, you know, that has the exact same impact as if they were, you know, and over time, the same physiological impact as if there was actually an acutely, you know, stressful event, you know. And so a lot of times these things are completely overlooked.
Internal environment is what you're saying is as important as external environment and direct experience.
Well, I think sometimes people feel like shame in that they have symptoms, or they'll ignore their symptoms because it wasn't as extreme as somebody else's. You know, they didn't do 4 tours in Iraq, so they can't say they have PTSD. And this is what happens to first responders all the time. They're like, I work on an ambulance. okay, but you've been dealing with these really, really, really stressful events over and over and over again for a very long period of time, and that is genetically, maybe you were predisposed to have these cognitive changes more than another person, or not. I mean, that's always a part of the mystery. Some people have 20-year careers as police officers and experience all kinds of stuff and have no symptoms. You know, genes may play a role in this that we'll later identify. But I think really what it is you meet these people and like they get shot at earlier in the day and they're just kind of like, yeah, well, it was what it was, you know. It didn't feel like anything to them, you know, for whatever reason. The way that they frame it cognitively, they don't hold any importance to it, you know. Maybe the way, how important they hold their life even, you know. So some people are just more affected by stress over time, you know, than, or an acutely stressful event than others, you know. Maybe genetics, maybe more just the way they kind of frame it. But either way, once you get, you know, underway with these cognitive changes of hypertrophied amygdala, atrophied, you know, cerebral cortex, you know, you think differently, you know, and it becomes very difficult to think of positive thought about yourself or, you know, about anything else or any situation or see the positive in a situation.
Are those symptoms?
They are. I mean,
like the lack of something, is that a symptom?
There's a lot of symptoms. There's a whole checklist of it. I mean, but obviously revisiting it, I mean, really what it is this brain, this segment of your brain is firing, you know, and it's saying, should I be scared of something? Should I be getting prepared for something? How high do I need to make my heart rate right now? How much adrenaline do I need to be pumping through my veins all the time? And then you deal with dips, right? Because when you're just pumping out adrenaline all the time, then you get these depression dips, you know, because you just can't keep up at that state for too long, you know. You get fatigued. And so that's why these things sort of blend, you know, like, oh, okay, I went through a stressful event, or, you know, due to my childhood, I generally speaking frame things in my head like this over time for a period of time, you know, and then there's just this cognitive shift that occurs, you know. But especially with like, and I've seen some studies on drug and alcohol addictions in particular, you know, childhood trauma is like one of the biggest factors. You know, if you had childhood trauma, your odds of, you know, actually inevitably ending up addicted to a substance at some point in your life just skyrocket, you know. And so, and obesity, you know, a lot of times we see people who are obese, we think, they're lazy, something like this. When you actually interview these people, very oftentimes they had childhood trauma. So, you know, they've been using food as a means to feel better, and people use all kinds of means to feel better. And so when you actually start to have sympathy for those childhood traumas and you start to really, you know, get some data on it, you start to realize like this person's just not lazy and fat. This person's got significant cognitive problems that could be addressed, could be fixed, you know, and they're just being ignored. And we're just like, oh, go jump on a treadmill. They'll never get anywhere with that method.
Don't you think that everyone has childhood trauma? I mean, relatively speaking, everyone has ups and downs.
Yeah.
And as a child, you don't have very much choice in anything.
Yeah.
Isn't like a 3-year-old traumatized all the time?
In the Buddhist culture,
Because they're always crying.
they talk about the conditioned mind, right? So they basically say as you progress through childhood and you become an adult, your brain becomes conditioned. Basically what they're talking about is everybody experiences some bullshit as they age. And it's your job in adulthood to decondition your mind, you know. And so to see through the patterns that you've developed in childhood, now that your brain has actually developed enough to do that, you know, and then, you know, grow from there. So in their culture, they believe everybody's screwed up. That's just growing up. In our culture, we're like, why do you think that you're screwed up? What happened to you that makes you think that you have the right to even say that you are screwed up from your childhood? Just two completely different competing cultures, you know. But I kind of agree with that more Buddhist mindset that no matter what you go through in childhood, good, bad, and different, either way, it conditioned your mind. And that's either serving you or it's not. And you can work on that in adulthood, but you can only work on it in adulthood. You know, only once you do finally reach a certain level of maturity can you actually start to reflect on some of these things and go, well, yeah, I generally speaking don't trust people with money. Or, well, what's behind that? Oh, well, I grew up with less. My parents made a lot of negative statements about people with money. Do I really hold that belief system towards people with money? Or are they really out to get me? Or authority figures, or whatever else it may be, you know? A lot of times that kind of stems from the way that your parents felt, you know, or how you felt about your own parents' authority, you know. Now you're dealing with dysfunction towards, police officers and things like this,
So it sounds like a condition of experiences create a pattern of conditioning, and then those conditions, the person learns skills based off of those conditions, right? They learn how to avoid something or go towards another thing. For instance, like if it's like I have a anti-authority bent to me, so I naturally am distrusting towards authority unless they can prove themselves to me. But then once they prove themselves, I'm like all for it, right?
Yeah.
But it sounds like, is that a kind of a correct?
So there's a distrust towards authority because maybe I'm just taking ganders and shots in the dark, who knows, but it's possible that your authority figures growing up, maybe from time to time, they were screwing up in some kind of way. They were making themselves not seem so altogether to the point where they weren't really a trusted authority figure. So now you don't trust any authority figure. Now you have to figure out in adulthood, does that mindset serve me anymore? It did as a child, Did everything that mother or father or whoever always say, was that always right? Sometimes they would tell me things and it turned out to not be right, Santa Claus wasn't real, turned out.
It's the first conspiracy.
Yeah. Inevitably, that's kind of the thing, is you have to kind of decipher these things in adulthood and figure out if they're serving you anymore, And a lot of times they're pretty hardwired. I like to think of it like the base of the tree. It's like, your upbringing is that trunk and these big branches. A lot of times if there's an issue with one of these, everything on the periphery is kind of messed up. So the way that you have your romantic relationships, probably stems from the way your parents' relationships were, stems from the way you were held as a baby. It's just like these things kind of blossom out in that way. So a lot of times when you're having a more peripheral issue of like, I don't really trust this friend or something like that. So maybe the core might have been really early on.
There's a lot of patterns in life that it's impossible to understand. Like, why does this keep happening, right? Unless you have some sort of therapy, some sort of outside person that's helping you guide.
It's a lot easier to see somebody else's problems than it is your own. Mm-hmm. So when you talk to a friend, a lot of times you go, dude, you gotta quit this, or just leave that chick, or whatever it is. It's like so obvious to you, but it's not so obvious to them. And I think that alone is a huge benefit. But then training, So you learn a lot, and then they're doing this all day, every day, right? So therapists talk to people all day, every day. They get good at pattern recognition and sort of a precognition about, like, as soon as they look at somebody, they kind of already be like, wow, this person probably struggles with this. Because after a period of time of just doing this all day, every day, you get really good at it, no matter who you are. So that's really what you're vetting with a therapist. And, just like anything else, there's good and bad and different. And you also need to find fit. So I went through like 3 therapists before I found one that was actually like, I felt like beneficial at all. And the one that I finally found, he wasn't even the best therapist, but he was really like action oriented. So he was like, okay, cool. I don't really want to hear you complain about it anymore. I'd like to figure out what we can do about it now, to move on. And the first time he ever kind of told me that, I was kind of like, what? Like I thought I just wanted to sit here and complain, and that he realized right away, like, this guy's not going to go anywhere with that. He wants something to do. He wants some homework. Blah, blah, blah. He's like, cool. You get anxious about these events. Can you meditate about them before? Can we journal about it? Can we whatever? I don't want to hear about it again because this pattern keeps happening for you. I just want to figure out what we can do to fix it and move on. That's atypical for a therapist for sure, but it worked well with me.
Totally.
And I don't know if he does that with his other, did it with his other clients, but it works well for me. I think anybody could benefit from therapy. You know what I mean? I think just any person experiencing the human condition could probably have somebody to talk to from time to time and allocate a period of time for their mental health. It's kind of like going to the dentist and getting a cleaning. It's kind of like, there's just certain things we realize that you have to maintenance as a human on planet Earth, and our culture, mental health is so taboo. We just think you should have it together for no reason. That's just obviously not the case. By the numbers, it's not. But there's massive suicide rates. It's certain populations the leading cause of death. That's crazy. And well, suicide is the end of the continuum of depression for sure.
They say depression's like a silent killer, right? Because people live with varying degrees of depression for their whole life, and they might not ever want to commit suicide or ever feel it enough to take action on suicide, but they'll still be depressed as fuck, and that will ruin the rest of their potentiality, right?
I learned early on in my career that you really can't tell. So my best friend James, he committed suicide. He was a paramedic for Austin. The last time that I talked to him, we got together, had drinks. We would talk about EMS calls all the time because he worked for one system, I worked for a different one. So we'd just kind of catch up. And a lot of times he'd just be kind of like, oh man, I'd have done this. And, you kind of fucked up. Like, you should have done this intervention instead of that one. And I'd kind of rag him the other way too. Well, so he's telling me about this 17-year-old girl that he treated, and she had multiple gunshot wounds. He took her to the hospital, and I'm kind of like, you probably gave her too much fluids, and like kind of ragging him on what he did. And this was pretty typical. And, I completely missed that this guy was saying that he had a really hard time with this call, right? And he had a lot of other hard calls too. And his EMS partner, who he had worked with for some period of time, actually had left a 24-hour shift and inevitably ran into a guardrail and died just recently. And he was dealing with some drinking problems. He had been, dealing with trying to get that under control for some time. And, all kinds of stresses in relation to his children and other things, But talking to this guy, you'd never know that he was really all that depressed. He was really happy, always joking. You really couldn't tell. And, a lot of that was a cover-up. I mean, the guy was actually an actor for a significant period of time in his life. He was really good at putting on a different face than he actually had going on internally. This period of time, though, I remember this conversation, and it was the only time that there was never any joking or anything about it. He was just bothered by this call. He had a 17-year-old daughter that looked a lot like this girl that he had just ran to the hospital, and it had just really hit close to home.
That's fucking hard.
Yeah, and that was the last time I ever talked to him, because he shot himself shortly after. And I don't know if it had anything to do with this call or something other thing that I didn't even know about or whatever else, but if you had asked me, before that, is there any possibility this guy committed suicide? I'd be like, absolutely not, James. There's no freaking way. That's not the guy, And you can't tell what's going on internally with somebody, a lot of times. And so some people, it's a lot more outward about it, but there's plenty of people that just walk around with, really poor mental health all the time, and there's just no outward sign. It's not like, diabetes where you're about to lose a leg or something like that. You can just be rotting on the inside and not know.
So is it kind of up to the individual to take an account of their life and then to say, okay, there's something wrong here. I need to get some assistance with this part of my life?
I would say early on, though, like in my EMS career, I never really put two and two together. So I remember one of the first times that I ever experienced PTSD symptoms or had a flashback. And I didn't know that's what it was at all. I mean, I just thought it was just this weird event.
What was the experience? Not without reliving it.
So no, it's fine. So I had this really rough call early on. We responded to a young girl. She was 21, pregnant, 8.5 months, something like that, about to deliver. And the call just came out as a cardiac arrest. We respond. Her father was doing CPR on her. She was naked, laying on the floor. There's not a lot of details of what the hell happened on scene. Her boyfriend's naked as well. Apparently they've been having sex. She got up. She said, hey, I'm thirsty. Had a seizure, hit the ground, didn't respond thereafter. They thought she'd had a seizure. Her the boyfriend goes and gets the father. Father recognized right away she's pulseless, starts CPR on her. So we get there.
Good man.
Inevitably, we, start working her. She's in VFib initially, a shocker. She goes to systole. I inevitably end up doing CPR on her for about 45 minutes on the way to the hospital with no avail, And the whole time I'm just trying my absolute best to just try to keep this baby alive, because originally we actually had fetal heart tones on the child. And then I was kind of afraid to stop doing CPR to even check fetal heart tones again, because I was afraid that period of time of no CPR would even, maybe potentially do it. So we're just ventilating the mother and doing CPR, and every now and then intermittently get a pulse back, but it was just kind of a sketchy situation. I had another really traumatic call that same night, involving a child that got decapitated in a car wreck and all this. I'm driving home from the shift, like normal, just finish up my paperwork, head out, and I'm going through this intersection, and I'd actually ran a wreck at the same intersection a few shifts prior. That was really, really bad. We had to fly out this patient, whatever. And I'm going to drive through it, and I just got this horrible flashback from this accident that I just ran there, where this woman was essentially screaming when we got on scene, and all the details of it were just like I was reliving it, just like it just walked right up on scene again. I was sitting there, and the light had turned green, and then it had turned red again, and then it had now turned green again. And then I had just been sitting there and never even went. I was just sitting there reliving this event. And I was like, holy shit, my heart rate's through the roof, it's just really, really, really high right now. I was having a full-fledged panic attack. And I was like, I never really had that before, so at first I'm like, oh my God, I must just have an arrhythmia, I probably just need to go to the hospital, and then I'm like, no, wait, it's probably not that, it's probably just anxiety, don't freak out, I'm trying not to let it spiral and, drive the rest of the way home. Well, they started happening really regularly, these little things. I would relive events that I had had, and I've always felt like in working EMS, I held the importance of what I was doing a lot higher than other medics. You know what I mean? And so I think that the reason why I always experienced a little bit more symptoms thereafter is because I always felt like what I was doing was really important. Some people just kind of shrug it off and just yeah, well, you win some and lose some. I never really felt that way personally. So I think that was, a nature of why I always experienced a little bit more, symptoms than others. But I didn't know that was just PTSD at the time. And I was 20, probably 22, maybe. It was the first time I'd ever really experienced it, and there wasn't anything oh, I better go see a therapist, I better go work on this, and things like this, None of that was there, and there was no critical incident stress management. There wasn't anybody who approached me and was like, hey, are you okay after these calls? You just dealt with 2 traumatic calls in one night, do you want to talk about it? Are you okay? None of that. It was just because, it was a rural 911 system, so, they didn't have access to services like that. When I got into flight, we'd run many calls per shift that were like that, you know what I mean?
Because you're on a helicopter, right?
Yeah, the intensity's higher.
Yeah.
And and there's plenty of regular calls in the mix. But long story short, I started to have symptoms from time to time again. Even after I'd been through a lot of therapy at this point and stuff like this. But at this point I kind of knew what to do about it. You know what I mean? I'm like, okay.
At that point when you were having these calls, you said you weren't aware of that you needed any sort of help or assistance in dealing with these symptoms until you actually were hit over the head with these symptoms.
Well, and it even took a long time thereafter. I felt like, it would have been weak. And I also felt like at that stage of my career, I was terrified to seek help because I thought that might mean that I wasn't cut out for it. Mm. You know what I mean? And then I would have to end my career or something.
But at that time, were you even aware that other people were having symptoms?
No one else talked about it. I only knew one other paramedic that was older. She had been a medic for 21 years that would actually even talk about ever having a hard time with it, that she had to take time off. And pretty much everybody else just kind of went on about their day, but they all had problems. Every single one of them would talk about how they had really hard time with drinking, wouldn't sleep at night, didn't really know why, all of these things where they were having probably plenty of symptoms all the time, and just sort of live their life that way.
So there's a whole bunch of first responders out there who desperately need assistance with their own
probably
psychology.
Most of them.
And yet most of the culture of it is that you don't need help, or not that you don't, but you don't even think to need help.
Well, and luckily the tides are kind of changing a bit, I feel.
Okay.
I think that some systems are starting to do more mandatory critical incident stress management. So you run a rough call, they do check in with you. A lot of the larger city systems, but the majority of the United States is not large city systems. It's mostly rural EMS with no access to any of this. Plenty of systems are volunteer. These people aren't even paid. So where would there even be a resource for these folks? There's no insurance for them to seek out, just normal therapy, things like this. EMS in particular doesn't get enough help politically with that type of thing. It's seen as a not essential service most places. So
Yet you're saving lives every night.
So fire department is oftentimes an essential service, and so is police. People. If a fire breaks out, we got to do something about it. We can't just let the thing take over the whole United States. So that's usually essential service. But EMS oftentimes goes optional, and because of at the very core of it as being an optional service, a lot of times the legislation towards things like there should be mandatory critical incident stress management and therapy available for all first responders is way on the bottom of order of priority. Order of priority way up is, they need new ambulances and things like this. There's a lot of things to spend money on long before mental health.
So that kind of targets your demographic for what you're doing now, for sure. Or at least a prime demographic, right? Because
that's my personal focus, and I know that, it's not that I feel unequipped to treat veterans. I just know that I'm particularly equipped to treat first responders.
Yeah.
And I can firsthand know what somebody means when they start going through their symptoms, because I've experienced a version of it. And they might have higher, symptoms than I ever did, but I at least have tasted it and know what they're talking about.
For everyone else, like just the person who grows up normal, goes to school, gets a job, has their own personal experiences, they still need help, right? Like most of the people still need assistance with integrating.
Yeah, I think where psychedelic medicine helps out kind of the most is this existential dilemma, And so many people struggle with it. It's sort of like, I'm working this job I'm not that passionate about, but I kind of make enough money to get by, so I'm not really going to change it. I'm in this relationship that's okay, maybe it's kind of got some problems, maybe not, but there's a lot of things about my life that aren't really particularly great, but it's just generally bland. There's just not a lot there for most people. And I think that places so much, what is my place in the universe? Question, even if they're not actively questioning that on a regular basis, it's just sort of they have this feeling inside of them that just something's off. And that's sort of a lot of times and people end up terming it as just depression. And it's it's a lot deeper than that, for most people. And I think that's one thing that, rites of passage, right? So almost every culture has had some form of this, and we just don't in America. And, rites of passage, it's freaking American Pie, you gotta lose your virginity, and then for young men, and then maybe it's drinking or something in college days to some kind of excess or whatever. And then, military is a really good rite of passage for a lot of young men and women, but it's that, no one questions your status as an adult after you went and served a tour in Iraq.
For sure.
You know what I mean? So that's a very obvious rite of passage. But, in a lot of cultures, if we were to talk about a lot of Native American cultures, there would be a ritual that was after this ritual happens, you are a man. No one questions that, And so I think with this absence of rite of passage, a lot of times it's sort of there's still these questions that are sort of looming, you know what I mean? Because, psychedelic substances were utilized in these rites of passage for a reason. There's a reason why they gave people peyote and did things to induce, states of consciousness of trance, be it maybe sweat lodge or, very painful ceremonies, long fasts, all kinds of things, But they would do things to induce altered states of consciousness to sort of answer some of those questions for people. What is their place? If it wasn't assigned to them within the tribe where their place was and told, you know what I mean? That's an important aspect too. We're not told at all who or when or what. The options galore in today's day and age, and so, we sort of a lot of times just kind of lost.
a lot of people just need to be told what to think or what their perspective is or what to do with their life, because you can literally, like in the first world, you have infinite opportunities, but that can be crippling, right? It's just like having a blank canvas. Like, what are you going to do with that?
Yeah, and I think so many times, people are self-medicating, and sometimes very effectively, And I mean, this is actually a really interesting case report I was reading about the other day. This doctor that said that he had this patient that was actually like a clinical pharmacologist. They came in and was like, hey, I've been utilizing PCP and ketamine regularly, almost weekly, and I had longstanding depression, and now I don't. This is what I've been doing, just once a week. And the doctor basically said, that could be really addictive, you should stop. And she's like, well, I don't really addicted to it. I just pretty much do it once a week. It doesn't seem to have any kind of, habit-forming nature to it at all, but I'm not depressed at all. And he's like, well, that seems really bizarre. Stop. He said it was the single biggest regret of his entire career was never researching why the hell she had a relapse or a complete remission from her depression. Because we could have known about this many, many, many years before, because there was people that were doing this. This was phenomena. But I think the problem is people also experience, like they look at this like it's just some chemical phenomenon in the brain. Like, they treat it like it's an antidepressant. They treat it like Prozac. They're just like, oh, you do this infusion and it's like some super great Prozac. And they're just ignoring this, psychedelic aspect of this medication, that, and that term psychedelic, ketamine is definitely an atypical psychedelic of many kinds. Really, it's a dissociative, but it has some effects. The effects being that it definitely decreases your ability to feel your body at any kind. So it's almost like being in a float tank. You have no bodily sensation, and then it dissociates you from the story of your life. So you don't really remember or recognize or acknowledge who that person and that construct that you created about that person, who you are, is. Because you're not thinking with those normal parts of your brain anymore. So now when you reflect on something from your life, you're not reflecting on it from the normal chain in which you normally go. You're reflecting on it from a different part. And that's how you gain perspectives on things. It's like, oh, I witnessed bad things happening to good people. Now I have some means to figure out why that happens. Through the normal chain, it takes, we may never really get to a good perspective on that.
Just to get to that statement.
Yeah, And the other thing that it is it's like a big lubricant for therapy, So a lot of times, especially with, men in particular, ever taking, they might see a therapist 100 times before they, are finally feel comfortable enough to go into childhood stuff, But you give them a small dose of ketamine and it just flows out, and so then that way it's kind of an amplifier, And I mean, the same things, this is one of those things, this is how we're utilizing the substance. Almost all substances can be this way. Like say you can drink tequila because you want to go dancing on Friday night, or you can drink tequila because you just went through a divorce and you want to suppress it. You can use one substance for many different, things cognitively. We just happen to be using it in a therapeutic light, You could use it recreationally. It could be fun, or it can be, we can use this and guide it appropriately with a therapist. We can take this to a very therapeutic place.
The primary focus is to help people psychologically, and you're using ketamine as a chemical primer.
Ketamine, from a neurochemical standpoint alone, can buy somebody some time. A lot of times, even just an hour, 4 hours after their first infusion, oftentimes somebody feels completely better. The more severe their symptoms are, the bigger of an impact that they'll probably feel. The way I see it is this is just a period of time away from your symptoms for you to start working on all of these other things that you don't normally have the energy to do. When you're really, really depressed and can barely get out of bed, you're not going to start a workout plan. You're not going to go get a personal trainer. You're not going to go trash all the bad food you got in your house and go get some new food. You're not going to start meditating. You're not going to do all these things. You're just going to do your normal patterns. But if you can get somebody out of their normal symptoms for a period of time, you buy them 3 weeks, a month, 2 months, whatever it is, to start on these other patterns. And those are the things that give you the longevity. And the other thing that gives you longevity are these therapeutic breakthroughs that occur intra-infusion, these perspectives gained, these types of things. So, I've had one patient, last infusion, she's quiet, and then all of a sudden, she just goes, I'm not broken, And it's like, I have no idea what's going on a synaptic level, but I know that it was just like, there's a hardwired, I'm broken, everything I do is wrong, I'm never going to get better. And there was just finally that one that bypassed it. It was like, she says, how could I be broken if I have an amazing husband, an amazing child, and an amazing career, and all these things are going well for me? That's not the type of thing that happens to a broken person. And it's like, there's no way that's not going to have a lifelong fallout. I know she just said it in the moment, but it was like, she also finally solidified it, that she's not broken, And to me, that's just, it's so powerful, because that's something that could take just a lifetime of therapy to finally get to, and this just happened spontaneously in the middle of infusion, because she's finally thinking a little different. We altered neurochemistry just enough to get her to gain a perspective on the true nature of her life, not this one that she had created and been working with for so long.
And you create this sort of environment for these spontaneous experiences to happen, right? People come in here, go through a process, but this whole time they're going through this process, they're being led to expect some sort of experience, right? Some sort of better experience. Like, I don't know how to put it proper, but some sort of experience that leads them to an understanding of some sort.
Yeah.
Right.
Yeah, exactly. So from the first time that I contact somebody, the first conversation that I have with them, when they decide to undertake going through a series of ketamine infusions. And the cool part is that it takes, some time, 4 weeks, 6 weeks to kind of complete this initial series. I let them know right up front that this period of time, you are going to allocate for your mental health. We're going to get your diet in order, we're going to get you exercising, you're going to do all of these things while we're doing these ketamine infusions. And they get, and it's interesting because a lot of times this starts to happen organically. I had this patient recently that was like, it's really weird, but I just didn't feel like eating crappy food anymore because, I'm spending this money and I'm going to these appointments, and a lot of times I'm tired for hours afterwards, and I'm like, really, front loading to get better. Mm-hmm. Like, the last thing I want to do is cram a bunch of crap in my face and ruin it all. And so there's another financial means to also want to try to accelerate that experience. So there's a lot of motivation that comes to finally getting it together. The cool thing is when you do something for 28 days, by study, a lot of times it becomes a habit. So that's always my goal is, what can I do that, creates a habit for somebody? And then, the deeper thing that, as a nurse, I'm always kind of after as well is how can I generally make this person healthier and avoid them from having heart attacks and strokes and diabetes and these types of things? Because, what really makes you depressed? Having a heart attack, that really kills your life quality. And so if I can get somebody, not drinking sodas on a regular basis, and avoid diabetes inevitably down the line, if I can create a habit that inevitably, okay, so for 30 days they didn't drink sodas, but inevitably now they're only drinking them once every 2 months, over their lifetime, I stopped them from having diabetes. I may have helped their mental health this much right now, but when they're not dealing with going on dialysis later on in life, I help their mental health extremely significantly down the way. So I'm not only focused on just this little period of time where I have them and turning around up front, I'm focused on way down the line.
I'd like to know the phenomenon of why people even decide they want to get help,
Yeah.
at all.
When they finally, pull the trigger on saying it's time.
Yeah.
Well, there usually is a precipitating event, just recently I got contacted by a patient, and, she's like, I'm alone on the holidays. And, just kind of having a midlife crisis, she kind of termed it, Obviously this has been building for a really long time. She probably hasn't been feeling well for a really, really long time. And it's finally okay, I got to do something. And that is the nature. We do typically collect sort of patients that are almost at the verge of suicidality, because if they don't get better with us, that's probably what's going to happen.
It's just so crazy to me that it takes a precipitating event or someone has to hit rock bottom, or someone has to go through some hardcore shit just to be like, I can't do this anymore. I got to find a solution.
Slight aside, I had this patient the other day that kind of cracked me up. I was like, so tell me about, he just got sober for 6 months. And I was like, tell me about the precipitating event that led you to get sober. And he was like, well, I was walking my dog and I didn't really have my shoes on. Next thing you know, I'm hogtied by the police and whatever. And I was like, wait a minute, you're walking your dog without your shoes on, you're hogtied by the police. I was like, I feel like there's a few details that you just left out in there. I don't know. And he's like, well, I didn't have any other clothes on either. You know what I mean? And I was like, oh, okay. Well, that started to make more sense how you inevitably got encountered by the police or whatever. And he's like, yeah, and I might have attacked the police when they tried to stop me, or whatever. And I'm like, oh, so you just were walking the dog naked, right? Anyway, my point is obviously there were some issues there, but it was funny how he initially framed it in his mind. It was just I was just there walking the dog without my shoes on, and I'm like, how can you get real with where you're at mentally if inevitably you just were oh, I just inevitably just got hogtied by the police because, I was walking with my shoes off. Let's address the real situation here. But anyway, I thought it was hilarious.
It kind of requires some sort of honesty with yourself to say, okay, let me go out on a limb and try this ketamine clinic,
Yeah. Well, I think, the problem too is, mental health is, or mental health issues are so rampant, in America that it's almost kind of everybody's got some anxiety and tons of people are on antidepressant. And, we just in America just kind of have this baseline that everybody's, kind of dealing with it, And I think we also kind of termify depression really weird, so we just treat it like it's this disease process, which there isn't really any data that that's real, so the monoamine theory of depression, meaning we just thought, one day you just woke up and your neurotransmitters were just off, there isn't any really data for that, there's a whole lot more data for, you experienced childhood trauma, you are dealing with symptoms as a fallout from that, that data is there. So the deal is when you go through, I'll just take it on an even more physiological thing. When you don't exercise, when you don't eat well, when you don't sleep well, we know that there's dips in neurotransmitters that occur. If your biome gets off, you have antibiotics for a period of time. Most of your neurotransmitters are generated, by the bacteria in your gut. You will experience a dip in your neurotransmitter levels that inevitably have a fallout of symptoms that feel like depression, inflammation. If you have a condition that would lead you to be inflamed, So if I take basically a lipopolysaccharide, right? So basically the constituents of bacteria that let your body know that you have an infection, if I inject that into your bloodstream, you will experience symptoms of depression. So, because the inflammation and the fallout from that inflammation inevitably lead to signs that make you feel depressed, So, there's some really true identifiable physiological aspects of depression and particularly the physical sensation of depression, which oftentimes, radiate with the cognitive fallout. But, so there's some real identifiable stuff, So none of those things though are permanent. They're not just something that just happened to you, there is, we identified some genetic aspects that make some people more, likely to experience depression when, inevitably they have these sorts of fallouts. So in others, but there's genetics behind it. Some people only need 4 hours of sleep genetically. Some people, there's a lot of different, genetic variations. But generally speaking, most people, you put them through certain situations, they will feel depressed. Mm-hmm. So that's just a condition, that somebody's currently in, but not something that's permanent, And, there are cognitive things that you can go through in your life that are, very obviously correlated with feeling the physiological symptoms of depression and dealing with sort of, ruminating thinking, self-referential thinking, all these types of, thought processes that are, not wanted. And, but none of those things can't be inevitably gained perspective on. There's nothing that says that any of these things are just, a death sentence. You got raped, you will deal with, not being able to handle that for the rest of your life. You will never be able to gain a grip on the perspective of that. There's nothing that says that. So I just don't understand why we treat it as if it's a disease process that's uncurable. It's, as with, like, say, diabetes, you've got, some cells in your pancreas that are starting to, not be as functional, and inevitably that's usually a progressive illness. And even if you do dietary modifications, you'll probably still always have a little bit of a hard time dealing with that blood sugar because of the damage you did. Or say you drank a whole lot, throughout your period of time. So, inevitably you're starting to decrease the stem cells in your liver, and your liver becomes cirrhotic to the point where it can't repair itself anymore. You will not recover from that, completely ever, even if you quit drinking. Those are disease processes. But there's nothing that says that you can't recover from depression or anxiety or anything like this. So I just don't understand why, as a whole, in medicine, we just treat this as like a disease instead of a condition, and something that can't be smashed, something that, remission is just not even the goal.
And you're saying that if you hit all the points on the chart, like get all the beats down, that the likelihood of you still having a depression is like super minimal, right?
Well, it's particularly when we're talking about the physiological aspects, we know you correct the physiology that's causing the physiological symptoms of depression, you should have less physiological symptoms, But the cool thing about this whole deal is, we all recognize the spiral down, right? So like you were talking about with your depression, it would spiral out of control down, right? But no one ever recognizes the spiral up, right? So you take care of enough things and it starts taking care of itself, and you start to spiral up. That's always my goal. And I think that if you can take care of like that, 60-70% of physiological stuff.
You're mainly focused on lifestyle, which means making sure, okay, wait, just make sure you're hitting these points, right? Like you're eating right, you're exercising, like just hitting these points, right?
I think that every, medical clinic, no matter what you're treating, needs somebody doing this. So, our physician is going to check into things like, do you, have a big history of high blood pressure that would bar you from getting infusions? They're going to look into a lot of things. And our clinical psychologist is going to talk to you about past childhood traumas and, dive into the psychological aspect. There's just like all these looming categories. Like, do you have sleep apnea? Have you ever meditated? Do you have passion in your job? How many courses of antibiotics have you been through in your lifetime or recently that are just not going to get hit typically in some of these larger evaluations? And a lot of times, the answer to someone's issue is one of these things, So, untreated sleep apnea, we can give somebody ketamine, we can do a whole lot of therapy, but if they're just completely in the dump with sleep apnea, their energy levels are horrible, a lot of times they're never really going to feel better physiologically, and they're inevitably the same kind of downward spiral with their thinking is going to occur as well. They're always going to fill in that hole. And a lot of the times the people that we collect have tried a lot of things. They're like, no, I tried meditation, it didn't work. To me, that's an interesting challenge, because I'm like, okay, well, I can't just show this person some breathing exercises and expect it to work. I need to figure out what was the reason why they couldn't meditate.
Right. You have like a certain path that you can go down, and there's certain flags that happen when you're interviewing someone. Yeah,
like, so someone says, I say, do you find what you're doing for a living? Do you have passion for what you're doing? And they go, kinda. I mean, that's a 9 out of 10 on the questionnaire, but how they answered it is like a 2,
Yeah.
And so, there's a lot in going through it in person. And I think sometimes people aren't really real about it too. You want to know what the most like anti-suicidal thing ever is. That's be watching like something slowly progress through time and get a little bit better all the time. When I'm working on some project on the side, something outside of this, whatever else it may be, and I'm just like getting a little bit better at it all the time. And I just can't wait to see where I'm going to be like 2 years from now on it, you know? And there's no end. I'm never going to be the best at it or whatever it may be. Something like jiu-jitsu, it's like you're just getting a little better all the time. And sometimes you're a little worse. And then you try to get caught back up, you know? And to me, that's like, you know, the most anti-suicidal thing ever. And if I can find those things for other people, and I don't know always what it is. I had this one patient that like, she was basically telling me she hadn't done art in years, but she was like an artist. We did an infusion on her the next day, you know, she's like, you know, I'm painting. You know, I'm like, when do you want to schedule again for another infusion? She's like, I don't know if I do. I think I'm good. Like, this is as good as it gets for me. I'm painting. I haven't painted in years. And it's very possible that that one little habit that she started again is going to keep her, you know, maybe she's not like in remission. Maybe she's happy with being 30% depressed and maybe that's enough. But that little thing that she started again, inspired by these infusions, I mean, that's amazing, you know, and I think that's plenty for some.
That's a huge ripple, yeah.
You know, for her, that was what started the spiral up, you know, and it's just kind of, you know, I'll stay in contact with her and make sure that that's still going well for her. But, you know, I want to tell people the realistic story that when you do one of these infusions, you're going to have a lot of content that comes out. You may not feel better afterwards because when you finally reflected on getting molested as a child, do you expect to feel fucking great the next day? It's not going to be that way. And I found more often that patients that actually had some more content-rich negative experiences actually fare better over time than those that it's just like good the whole time. Mm-hmm. You know, I think the ones that it's good every time, they're just getting the neurochemical benefits of ketamine alone. They're never really getting into the content that will lead to long-term remission.
Where there's that challenge, right? If you're faced with a challenge, you naturally, like any human can overcome pretty much any challenge that they're faced with. So, but if you're not faced with a challenge, then there's nothing to overcome, right? So if it's just always sunshine and rainbows, and it's like, you aren't going to go very far.
I think for some people too, just they learn that in a completely alternative cognitive state, I was able to face something that was really, really rough. Why can't I do that under normal cognition? Why can't I talk to a therapist about something like that if I can do it while I'm also dealing with spinning down a fractalating vortex?
Fractalating vortex. Yeah, and that's like the challenge, right? Like, oh, I can't talk about this while I'm in a consensus reality. Like, if I can't talk about these issues in this state of mind, why, you know, maybe I should try to overcome that blockade, right?
Particularly with like anxiety and OCD, so much of this is an issue of control. And so somebody is very much relinquishing in their control when to do a ketamine infusion, you have to relax into it. You can fight it. You can, you know, the medication is not going to do anything you don't let it do. You can just sit there in the chair and twiddle your thumbs. People have very different experiences, and the difference in experience is how much they can relax into it, how much they can surrender to the infusion. And so that's a really interesting practice for some people, because for some people, they need control over every aspect of their normal daily life. And, you know, it's sometimes even spiraled to the point where, you know, they don't drive because that's an out of control situation. They don't want to hold down a job because they might lose that job, you know, or all kinds of things like this. So the absence of control in this really cool setting where it's like, you know, we've got this therapist to make sure that if anything cognitively gets difficult for you, they're going to help you to sort this out. We've got this person to take care of your body while you go into this. You're not going to be able to feel it or move it or anything. But we're going to take care of you while you do this infusion, and, you know, you just get to journey and let go and release and let go anything you want, you know, and you're going to take a break from this control state for a little while. And when you get back, if you want to be in control of things, that's cool.
Isn't it everything about the choice that they're making? I mean, everything from the moment that they decide that they do or don't want help, it's like, it's a choice, right? You're going to say, okay, I'm going to go do this now. I have some intention behind it. And it's the same with you. Like you've already made the choice to help people, right? You and your doctors that you're working with.
Well, so when I was in early MS, I just got slapped in the face with me or you may drive away and this be our last moments on the planet, because I watched over and over and over again people just die commuting to work. I'm really thankful for that because it makes me realize that I've only got just this little window of time here. And what do I want to do with it? Do I want to be selfish? Do I want to squander it away? Do I want to stare at my phone the entire time? Do I want to sleep till 3 p.m.? And, what kind of time do I want to have while I'm here? And what do I want to do with my time? And, I figured out really, really quick, like, the best I ever feel is when I've helped somebody else. We just have this innate ability or innate desire to help others. We feel really, really good when we help somebody. I remember the first time I ever helped somebody, and I've just never felt like that good ever. Like it was just addictive, and I had we were wrestling, I had this friend who was cutting weight, and I took some of his mom's diet pills and everybody collapsed down on the track. Take him in to the school, show him the coach was like, this guy needs to go to the hospital. So I put him in a car, I drive to the hospital. And I go through a few red lights, I'm speeding, stupid, reckless, carry the guy into the triage table in the ER and throw him on there and he's all lifeless, like this. Yeah, it turned out he had real bad potassium problems and was having all these arrhythmias, you know what I mean? So the doctor comes and gets me, to basically explain what the situation was, as an historian, and he explains the guy almost died, and that they were able to kind of intervene.
So it was good that you were speeding recklessly. It
was. I should have called an ambulance. That would have been a lot smarter, but I felt like for some reason at 17 I was the only adult in the situation, and it was that was the decision I made at the moment, was just go. What I handled ideally would have done different today, but long story short, I'm leaving the emergency room, and the doctor didn't say you saved this guy's life or anything like this. All he said was, this guy, he was actually giving me a lecture about cutting weight. He was like, don't do this to yourself, is really the lecture he was giving. But he was like, this guy could have died, and all I heard in my head was, me driving this guy to the hospital saved his life. Whether or not that was reality or not, but at the moment, that's what I felt. And I remember walking out of this emergency room just being like, I want more of that. This feeling right here that I'm feeling, this is the best I've ever felt. It just felt like I was walking on a freaking cloud. And it was weird, and so I ended up reflecting on this. I was actually in a medical terminology class at the time because I had considered doing medicine, but I was actually thinking more athletics, maybe go be a personal trainer or something like this. I kind of saw myself as maybe I'll be a high level personal trainer, but I was like, maybe I should learn a little medicine just to be even better, doing this or whatever. And it was one of those things where it was she was like, well, have you ever thought about actually being an EMT? That's what they do. They drive people to the hospital. You could do that for a career all day, every day. You could do that if you're interested. And I was like, man, that really sounds like something, And I'm driving through traffic and I see this ambulance, and I was just like, man, that does sound cool, It's kind of funny because I didn't know how to go to college or anything. And, obviously, I don't know, I didn't have any help with the process whatsoever. So it's kind of funny because how do I do this? So I go to ACC and I was like, hey, I'd like to sign up for the Paramedic program. And they're like, we don't have one of those, but we'll put you in math and, English and things like that. You can go transfer to a school that does after you get those things done. And I was like, I'm pretty sure y'all do have one, and she was like, no, we don't, you know what I mean? And I'm like, I've heard that you do. And they were like, and so I'm kind of bummed. I'm like, oh, I'm not gonna go do a bunch of fucking math and English, it's stupid. You know what I mean? I'm like, I'm never.
Dude, you don't want to do not what you want to do. You want to do what you want to do.
I wanted to jump in there.
Yeah.
I want to do it, And I was like, I don't think I'm gonna make it through that process. I'm like, I'm not really into it. So I just kind of whatever. So I'm driving home and I go to an ambulance station and I walk in and I was just kind of like, hey, how did y'all become paramedics? They're like, we went to ACC. Both of them had. And I was like, well, I just went there and they said they don't have a paramedic program. They're like, they're wrong. You gotta go to this other campus, go there, talk to them. So I go to the Eastview campus. I walk in, there's this guy sitting there drinking coffee. I'm like, hey, I'm trying to sign up for this paramedic program. Do you know which person I talked to? He's like, I'm the dean of the program. And I was like, he's like, yeah, come to my office. I'll talk to you about it. And he's like, I actually have one spot left for the program, which starts tomorrow, but you got to come up with like $400. And I'm like, God, I don't have $400. And he's like, don't worry about it. I'm going to sign you up. Can you give me $400, like, eventually, And I'm like, okay, cool. I can probably figure that out. So the next day I show up, and I'm like, oh shit, college, you know what I mean? So I walk in, it's completely packed. I'm late, because I was a screwball, like really bad at the time, And I used to just like get on the drum set and play for like hours and then like, miss, classes and things like this just because my ADD was so uncontrolled at the time, It's hilarious, but there was like, I don't know, 60 some odd, people in that class or whatever. And there was like, they're going through, everybody's like introducing themselves. And like some people are like physics professors and like, going back to school to be, like something that they're passionate about, and lawyers and all kinds of like walks of life. And generally speaking, people a whole lot smarter and more life experience than me. And I'm like, I'm no way I'm gonna pass this damn class. Well, after like 4 weeks, like there's only like half of them left. A lot of people just decided they didn't want to do it or whatever. But the way I saw it is I'm smarter than at least half these fucking people. You know what I mean? When we graduated, there wasn't that many left at all. And I was like, well, hell, maybe I can actually become a paramedic. It's pretty crazy. I'll continue on, But it's kind of funny because it's like, it's one of those moments where like, if that dude wasn't standing right there at that moment, I probably would have walked around the college and left frustrated and never researched it again. I would have been like, dude, I did more than enough. You know what I mean? I went to an ambulance station. I went and talked to people. They told me, I don't know how to do it. I would have probably still be working retail today.
Probably not. But
I don't know, man. I was done. It was just one of those ones where somebody had to like hold my hand through the process. Yeah. They really did, And, it was, anyway.
Well, yeah, it was a very synchronistic event.
It was really funny, and the way it went. But anyway, now inevitably I've done medicine my whole career. And I've been able to do everything I wanted to do. I've worked in every, facet of medicine that I wanted to. Mm-hmm. So critical care, emergency room, flu, obviously working on, different areas on an ambulance. Flight in particular was something that I wanted to do early on. And, as soon as I ever saw the first helicopter land on scene, I was like, those dudes, I want to do that, And I just saw it as like this lofty goal that would never happen. I thought maybe like after 30 years, I'd go do it for some period of time or something like that. And it was another one of those things where it was like, I was looking for a new job because I was in this like rural emergency room that I didn't really like working at that much. And I kind of was just looking for something different. And I was like, I'm gonna put out some job applications, some like, different ERs and things like that. And I saw this one job posting, for a flight job. And I was like, maybe I should just go interview at one just so I know what the interview process is like. That way I can eventually like start working on those types of questions, things like this. I go to the interview and it was hilarious because I'm an idiot. So I showed up like 40 minutes late. Mm-hmm. So I'm like, I call the guy, like the CEO dude, and I'm like, hey, I'm like running extremely behind. Should I even show up? And he was like, I'm not gonna tell you not to show up. It looks really bad that you're this late, but feel free to show up, right? And I was like, dude, I'm trying to get there. Like, I was like, it just wasn't going well this morning. Like all the stupidest things you can do for a job interview. So anyway, I show up and they're like, hey man, you only got like 20 minutes to complete the test, but if you want to give it a go. And I'm kind of like, does anyone have a pencil? Because I didn't even bring a pencil. And everyone's just kind of like, what a, you know what I mean? Like it was looking bad, right? It was not looking it was going poor from get-go, right? And so I sit down, I didn't really have time to think about any of the test questions, And so I'm just kind of going through and I'm like, man, at the time I really didn't even know, there's a lot of questions about ventilators and stuff that I just didn't even really know at the time. And I'm just...
Really? There's lots of specifics.
Yeah, and of course, and so I, the guy next to me, I'm kind of like, hey, after they make us turn his test, I'm like literally the last one. I'm kind of like, barely even able to like read the question before I'm trying to answer, and then so I go through it, which for me was probably pretty good because I'll overthink shit, because I actually know a lot about it, so I'll sit there and like start reading into a question a whole lot and everything else. So it's really good to just like boom zoom through it. So I zoom through it, turn my test in, and I'm talking to the guy next to me, and he's like, oh, I've been flying for like 5 years at this system. I flew in from Florida to try to come get this job, super prestigious place. The girl behind me, same kind of thing. And I start realizing every single person in this room is already flying. And I'm like, well, I'm not getting fucking hired. It was like a room full of fucking 60 people, you know what I mean? And they're all flying. Like, why the hell would they hire the one guy who's not flying, That'd be dumb, And so I was kind of like immediately like, I shoot up 45 minutes late. And I was like, I should just leave. I shouldn't even interview. This is stupid. You know what I mean? And everybody goes before me. You know what I mean? Like, I'm the very last one to interview, And I sit down, and they're kind of like, they start asking me some questions, and, and I'm answering them and things like this. But I knew I wasn't going to get hired. So I'm just literally like, this is practice.
Yeah.
Like, I'm just kind of going through the motions, About halfway through the interview, he goes, you're the only person that passed the test today, and you did it in 20 minutes. And, and everybody else, of course, like got an hour and a half or something like this, And I was like, you mean I passed that thing? And they were like, no, not only did you pass it, you scored higher than our medical director. And I was like, and the medical director's over there, and he's just like, yeah, man, you got a few questions I missed, And I was like, I probably wasn't paying attention to that. It was probably luck, right, And he's like, oh, you don't even have to chalk it to luck. That's pretty damn good. And, and for all I know, I literally just had the luckiest, circling ever, for all I know. But I'm like,
question, I got it.
Yeah. And then they asked me this one question. They were like, when would you treat, diabetic ketoacidosis? Like, at what pH would you treat this with sodium bicarb or whatever? And I was like, 7.29. I threw a number out, right? And they're like, did you read our protocols before you came here? And I was like, no. And I was like, it was a guess, right? But it was just like one of those things that so when I really read their protocols, like that's the exact number in their protocols of what you treat.
7.29.
Yeah, down to the point, right? Anyway, so, and I was just kind of joking, because I was just kind of like, I'll give something very specific number, because I was just kind of like, whatever, And they were like, did you read the protocols? Like, holy shit. And I was like, so anyway, I'm looking like some sort of like savant genius to these fucking people. Like,
you're all fucked up.
Yeah. And anyway, so it was just this hilarious.
No credentials.
So later on, yeah, exactly. I'm the only one not flying. Like, So anyway, later on, they called me and they were like, yeah, man, I didn't see it coming, but we actually want to offer you a job, And they were like, do you think you could not be late, to the actual job, And I was just like, yeah. And they're like, we want to offer you this job. And I was kind of like, what? Like, I was not planning on that. So, anyway, I totally went and did it. But it was just one of those ones where either I just happened to just completely like have that, run the table pool game, on this whole interview process. But I really think what it was like the only time I was uninhibited because I just knew I wasn't going to get hired.
All this started because you made a choice. You were following like this intention. Like you were like, I want to do this. I want to chase this feeling. And then you were just open to these experiences and you're like, okay, that's it. I think that's where I'm going, right?
Being late even played a role. It's just kind of like, what if I went late? I probably would have overthought a bunch of questions, maybe not passed it. Then I would have just been right in there with everybody else. You know what I mean? It's just one of those things where you never know where the fallout, this is something I always try to explain to my patients too, is it's like so many things are like that. So we're like, 3 to 5 years go by and then you go, oh man, thank God I was fucking late. At the time I'm like, this is the worst thing ever. I'm fucking an idiot. Like, this is so stupid. But you give it some perspective and time and you're like, thank God I was late. Like, it's part of the story, and it's a hilarious part of the story, and probably the whole reason why I inevitably ended up doing all of this thing. But that was the thing at the time was the worst ever. Relationships that fall apart. You give them a few years, you're like, dang God, I don't know that person anymore. Jesus, these things. So to me, this is like the value of, to relate it back to where psychedelics and ketamine infusions in general, help is it's like the ability to gain those perspectives sooner. Meditation can do this, float tanks can do this, therapy can do this. There's a lot of different modalities, but it's just another way to rapidly gain the perspective you need to be able to move on from something.
That's a good place to end.